Hi, my name is Ashley Sanderson, and this is my PowerPoint presentation on my community assessment project. The community in which I decided to assess is Murray, Utah. Murray City is a beautiful city in the heart of Utah, just 15 minutes south of the capital of Utah, Salt Lake City. It covers 12 square miles and 7,800 acres. It's Utah's 15th largest city with an average population of around 49,000. The population growth rate has actually decreased since 2018. Murray has a high crime rate in comparison with other cities in the state, possibly because of the central location and also essential roads and freeways and tracks and front line all have stops and off ramps and on ramps in Murray City. It's easy to navigate around Murray because of this, which makes it a central city with lots of shopping and dining and Intermountain Medical Center, which is the heart of Murray. The problem I have decided to address and have built my intervention around is suicide by opiate overdose, whether it be intentional or accidental. An average of 557 Utahs die from suicide. It's the second leading cause of death for children ages 10 to 17. People at an increased risk for suicide include alcohol, drug, or substance abusers, people with mental health issues, people with easy access to firearms or pills, those with lack of social support, or young people or old people who have relationship issues, or those in school with school problems. Our nursing diagnosis is simply that Murray residents are at an increased risk for overdoses as demonstrated by increasing crime rates, school dropout rates, and the increasing suicide rates by adolescents due to the lack of social support and opiate epidemic. Our goal was to decrease the number of suicide attempts related to opiate overdoses. Overall, we would like to decrease the number of children who have tried opiates. Those that never try it won't have a problem with it. And so to support this, Healthy People 2020 states brief interventions have been shown to reduce problematic substance use among adolescents and are especially useful for individuals who have moderately risky patterns of substance use. So if we can decrease the number of people who are using opiates and decrease the exposure that children have to opiates, hopefully we can prevent them from ever using them. One of the primary interventions we were going to have was to make Narcan kits to be able to hand out people who have risky behaviors or who are at risk of overdosing, specifically hand them to them or friends and family. But due to the coronavirus and social distancing, we were unable to do that. So we have created a poster to hang up in the emergency department's physician charting room to remind physicians to prescribe Narcan kits to these patients and potentially their family members so that they may have them on hand and help educate them on how to use them. Here is the brochure on the left-hand side of the screen that anyone can come into the emergency department and get. It's at our front desk. It is also in the social worker's office and the main room where the physicians sit. Nurses have also been educated about this brochure that they can hand out to anybody that they feel is at risk for an opiate overdose. And on the right-hand side, there's a poster. That's a poster that we had printed that is hanging in the physician's charting room to act as a reminder to prescribe the Narcan kits. Thank you for taking the time to listen to this PowerPoint and review it. Here is a list of references where specific statistical and information was retrieved from. Thank you.